an STD that spreads through parasites. Pretty scary, right? Trichomoniasis is a sexually transmitted disease that is found all over the world. It's commonly known as trich, and its Latin name is Trichomonas vaginalis. Trich is transmitted through one-cell parasites, which is highly contagious, and annually it affects up to 206 million people worldwide. In females, trich affects the vagina, cervix, bladder, and glands in the genital area. In men, however, trich affects the urethra and typically hides under the foreskin if uncircumcised. So what are the symptoms of trich? Typically in females, some symptoms include vaginal discharge being a different color or having a different odor, vaginal itching, or pain during urination or sex. In men, typically you see abnormal discharge from the penis, irritation at the tip of the penis, or a burning feeling during urination. Disease progression. Trich has an incubation period of around 5 to 28 days, and usually symptoms begin to show 1 week after contracting the disease. This means that you can have the disease but not show any symptoms and still be able to transmit it to other people around you. The stages go from vaginal discharge to vaginal spotting or bleeding to general burning and itching to frequent urge to urinate and finally pain during intercourse. Activities that put one at risk of contracting trich. Firstly, neglecting to use protection. Obviously, equipment like condoms are available to help protect you against contracting such STIs. Secondly, neglecting to take your routine checkups. This means that you ultimately fail to detect whether or not you have such STIs in your body, and you put others at risk as well. Lastly, neglecting responsibility. This means that if you do have an STI, you have to make sure that you don't carelessly engage in intercourse with others, or if you don't currently have an STI, that you have to be aware of who you're having intercourse with and being wise with your decisions. What are the long-term consequences of trich? Firstly, it means that there's going to be a higher risk of contracting other STDs. This looks like a higher chance of contracting HIV, AIDS, etc. And secondly, this means that there's a higher chance of, in males, developing into prostate cancer, or in females, developing into cervical cancer. Thankfully, there is currently a treatment available for trich, and it comes in the form of the metronidazole pill. Doctors can diagnose trich within patients by either routinely physical checkups or ordering a lab checkup to check whether or not a patient has contracted trich. If a patient has contracted trich, metronidazole kills the parasites that cause such infection. So obviously, this means that you get cured of the STI. This pill can also help you to prevent spreading trich to other people, reduce the chance of pelvic infection, and ultimately reduce the chance of an infection after pelvic surgery or developing into cancers.